Hey, this is Dr. Lowenstein, and let's say last week I put out a Facebook post asking for some questions about migraine surgery, and I got a bunch of them back, and so I wanted to try and make some videos addressing them. And one issue that was repeatedly queried was about recovery, and I can't answer that specifically because everybody's different and each operation is different. But in general, when we deal with the occipital nerves, particularly the greater and the third occipital nerves, we have to release those nerves through a channel of muscle, and that can be tender afterwards. So usually the majority of the tenderness is dissipated by about 2 weeks. But I don't want you to go sumo wrestling for about a month. A month and a day you can sumo wrestle. But everybody perceives pain differently, and especially patients who've been on pain medications, they can have different experiences. So I would tell people who are, have white collar jobs that you could probably get back to work in a week to 10 days. Not completely comfortable, but reasonably so. And this is again for the occipital region. For people who have a very physical job, I would probably say 2 to 3 weeks off, okay? But it's not really very different than any other operation that we do. So it's not an extended recovery, it's not a super short recovery. But it's a normal recovery, and I usually tell people to wait about a month before they're doing significant physical activity. And I would say the same for that for when we're doing the other nerves. So the supraorbital and supratrochlear nerve are done through an upper eyelid incision. It's very nicely hidden. But even a drop of blood that is on the inside after a surgery like that will settle down here and give you a black eye. So depending on how you clear bruises, you may have a black eye for, you may not have a black eye, but you may have a black eye for a day, and you may have a black eye for a week. It depends on how you heal. Now, when we do facial surgery, we usually say, 2 weeks for your friends, 3 weeks for your enemies. So at 2 weeks with makeup, you shouldn't have any problem covering up. But at 3 weeks, most of those issues are cleared. You can still have a little bit of swelling that might be visible to people that you know. But again, for the most part, that's not a really painful surgery. Your pain should be better after about a week. Your appearance should be fine after about 3 weeks. But I still don't want you to do anything crazy athletic for a month. These nerves over here, your zygomaticotemporal, your auriculotemporal, those are through small incisions, and those are not usually very painful to address. But still, take a couple of weeks off. No sumo wrestling. Don't want to get your blood pressure up too high, and you want everything to heal nicely. So after a month, you're fine and able to take advantage of your decreased pain. So that's a little talk about recovery. I hope that's helpful, and I really appreciate the questions, and keep them coming. All right, take care.